known outbreak. One case was reclassified, so the total number of cases has not increased. There are 13 Victorians in hospital, and none of those 13 Victorians are receiving intensive care. There has been a total of 2,925,810 test results being received since the beginning of the pandemic, beginning of the year. That is 18,934 results received since yesterday. To each of those almost 19,000 Victorians, we say thank you. That is a very, very strong testing number, obviously influenced by a quite amazing performance in Shepparton and across the Goulburn Valley, which I'll come to in a moment. But I know we say it every single day because it is literally the most important thing. Every single symptomatic Victorian needs to go and get tested as soon as possible. Don't wait a day, don't wait till Monday. Please go and get tested today if you've got even the mildest symptoms. That allows us to stop the spread of this virus, protect you and your family and every family, and it allows us to have the most complete picture of this virus and then take the safe and steady steps to open up, which I know everyone is yearning for. That's exactly where we'll be tomorrow, but that testing discipline is incredibly important and arguably gets more important as we take those further steps to open up. There are 11 healthcare workers who are active cases. The rolling average to 14 October is Metro 8.1, Regional 0.5. Mystery cases, none in Regional Victoria, all in Metro Melbourne between the 1st of October and the 14th of October. That is 17 mystery cases. The Metro Regional split the case today, that is a case in Metropolitan Melbourne, and there remain 7 active cases in regional local government areas, 4 active cases in Mitchellshire and 3 in Greater Shepparton, which is the same as I reported to you yesterday. There are now just 13 active cases in residential aged care. A total of now 4,880 shifts have been worked by hospital staff in private residential aged care, and we take this opportunity to thank each of those staff members on behalf of every family, every resident. That is an amazing effort. People who would never have thought that they would be working in private sector aged care, but have risen to that challenge and have brought a sense of stability and safety to that very vulnerable sector. No cases in disability facility settings. If I can now just give you a sense of Shepparton, there remain just 3 confirmed cases in Shepparton, with 234 primary close contacts and 177 secondary close contacts have been identified. So that means today there are still many hundreds of people across Shepparton and the Goulburn Valley who are isolating at home. I want to thank everybody who's come forward and got tested. I want to thank everybody who's at home isolating, doing the right thing to protect every family across that community and indeed right across the state. It's a deeply impressive thing. I can also thank all of those who have come from across regional Victoria, whether it be from Bendigo, from Albury-Wodonga, from Wangaratta, from a number of other health services, as well as support from different agencies to do that testing and to provide that public health response across the Goulburn Valley. We're very grateful to them. A total of 5,796 locals from Shepparton and surrounds have gone and got tested. That is a quite phenomenal effort in a community of that size. I'm told that there's only a few hundred results to come back, and they likely will be reported in tomorrow's test results. That is, again, impressive in and of itself. I won't run through the list of all the different locations, but I would just commend to anybody in the Goulburn Valley who's watching or listening, and to you guys, if you can make this a feature of your coverage, anyone who needs any further information about testing sites, call to test. So if you can't get to a testing site and you want someone to come visit you, then the website has all of that detail. Just finally, before I throw to Brett to talk about the numbers of the day, you would all be, two matters. Firstly, you'd all be aware that at around 5:30 yesterday evening, 17 people from New Zealand, having travelled on an international flight from New Zealand to Sydney, were then allowed to board a plane and travel to Melbourne. They didn't spend very long at the airport. They left the airport within only minutes, really, of having arrived. Our officers have absolutely no power to stop someone, to detain someone but in those circumstances, particularly given that they were coming from a very low virus part of the world. New Zealand is, and we're very pleased for them, in a very different set of circumstances to the circumstances that we're in Victoria. We are still waiting. I'm not quite sure why we're waiting, but we are still waiting for Australian Border Force to provide us with the passenger cards for each of those 17 people. As soon as we get that detail, we will be visiting each of those people and making sure that they are fully up to date, as it were, when it comes to the rules, the regulations, the structures that we have in Victoria. They need to be briefed on those things so that they're doing the right thing. I'm not sure that any of them would necessarily need to be tested, but of course just giving them the benefit of a clear understanding of what's required in Victoria, whether you're from Victoria or not, is very, very important. I just want to be absolutely clear on this. I've written to the Prime Minister this morning. We're very disappointed that this has happened, given that I had the previous day, or maybe the day before, written to the Prime Minister on this very issue, saying that at some point we will join that New Zealand-Australia travel bubble, but that's not appropriate now. This is effectively possible because we have not closed our border. I don't think these people could have travelled domestically into other states where borders are closed. That's exactly what the Prime Minister wants. We have done that, and now we see 17 people turning up on our doorstep without any notice, without any structure, and we still can't even get the cards from Australian Border Force as to who these people are and where they have gone. We hopefully will get that very soon. And what I have written this morning, just to make it plain, there's more flights coming on Sunday from New Zealand, and we do not want a repeat of this, where people, albeit not having a go at them, those 17 people or whoever might seek to come to Melbourne or come to Victoria on Sunday, but surely it's not beyond those who are responsible for the borders of our nation, making sure that only those who are in that New Zealand bubble can receive domestic passengers after they have arrived into an international airport. I'm confident that we'll get to the bottom of this by the end of the day, and we'll be in contact with each of those people and just make sure they know and fully understand what the rules are, what they have to do, masks, all the way through to those reasons to leave your home, so on and so forth. But I just thought it was appropriate to give you some background to that.
Just before you go on there, were you aware of the legislative position that there was no power to detain?
Well, I'm not certain, Noel, because I don't think we'd ever really turned our mind to this happening. Our position had been very clear. We are not in the New Zealand bubble. So we certainly know now that if there's unauthorised arrivals, if people are arriving and we just don't know, we have no way of knowing, we can be clear that there's no international flights arriving into Melbourne. But what we can't be clear on, well, I think we are now, but we couldn't last night be clear on the notion of them being allowed to freely travel from Sydney. So I'm confident that we won't see more of this until we get to the point, and I am confident we'll get to the point fairly soon, maybe, where we can have people from New Zealand travel, and indeed people from Victoria can travel to New Zealand if they think that's appropriate. But at a time when Victorians can't freely move around their own state for the best of public health reasons, it's not acceptable to me that people from another country, when we've expressly said that we don't want this to happen now, are able to get into Melbourne without us knowing. No warning, no. In fact, it's exactly the opposite of what we signed up for. It's happened now, it can't be undone. But our focus is on getting those cards, getting to those people, having a conversation with them about what's required of them now that they're in our state. And Noel, the other point is because we haven't got the cards, I can't tell you whether they're New Zealand citizens, whether they're Australian citizens. I know where they came from. I know how they got here. As a matter of fact, in terms of the method of transport, I don't know how they got here in a policy sense, because I had been express in my view that this should not happen now. It can happen in weeks or months' time, but it can't happen now.
Where are they? right now?
Well, until Australian Border Force give us the cards, we have no way of knowing.
Are they in Victoria?
They are in Victoria, and we assume they're in metropolitan Melbourne, and we will make contact with them as soon as Australian Border Force provide us with the cards, those disembarkation cards that we've all filled out many, many times. And hopefully by the time I finish standing up here today, those cards will be available.
How frustrating is it that it's taking so long? Is that upwards of 12 hours?
Well, it's a lengthy period of time. The good news is they've come from a very low virus place. It's not like they've come from some other parts of the world that are absolutely hotspots. But again, we'll get to the bottom of it and we'll make contact with them, and then we'll focus our energies not so much on being frustrated on what's happened, but making sure that we prevent any further people arriving unless and until we get to a point when we can accept and be part of that bubble. We're not opposed to that, and we're not for a moment casting aspersions on the state of public health in New Zealand. What we are just simply saying is surely our systems are better than this. Which I think is a fair thing to say. I stand here every day making sure that every Victorian knows they can't just freely move around their own state for the best of reasons, and at the same time we've got people being allowed in from another country, and we were literally the last ones to find out about it. It just doesn't make any sense.
Should they be fined then? Should they face a fine?
No, I don't know that they've necessarily done anything wrong.
Broken any rule?
Well, again, that'd be looked at, but I don't think so. But what we're really keen to do is to make sure that we have a conversation with them and that they know, you've got to wear a mask, the whole checklist of things that we're all very well used to. None of us are pleased about it, but we know about it. We need to be confident that they do, so that they can
send them back.
Well, let's work out who they are first and where they are, and we'll be able to do that once Australian Border Force provide those cards, which my advice as I walked in this morning is we haven't got those yet, but hopefully we'll get those very soon.
But if they're not Australian citizens, then should they be asked to leave?
Well, let's first of all work out. Well, see, I don't issue visas. I don't control the free movement from other countries into our country, and nor do I want to. That's not a matter for us. That's a matter for the Commonwealth government. The bubble arrangement is a perfectly reasonable thing, but not to Victoria at this time, and that's why we made that point clear. That would appear it hasn't gone through down to the level that it needed to, and these people have arrived, done nothing wrong in arriving in Sydney, but then they themselves haven't done anything wrong in trying to come to Melbourne, but they shouldn't have been allowed to come to Melbourne because we've not signed on to that bubble. It's very difficult to know about what their status is and the notion, to answer your question, until we know who they are, where they are, and what their status is. For what reason are they here? For all we know, and this is the most challenging part of it, because we all ought to know much more than we do, but the system has not worked particularly well. They could be from they could be from our state. We'll just have to wait and see.
At what point in the timeline here did authorities realise that this is happening? Like, were they off the plane and into metropolitan Melbourne before someone picked up on it? Do you know? I'm
not certain at this stage. I first became aware of this in the early part of the evening. But I think the timeline is they'd arrived at about 5:30. We're out of the airport by about 5:40, we think. And again, no one's alleging that they've done anything wrong. It's just a matter of there should have been a process when they tried to board a domestic flight to travel within Australia after having arrived at the international terminal in Sydney. Then the answer should have been no. Well, sorry, where are you going? Well, no, you can't go to Victoria. Victoria is not part of the arrangement that's allowed you to come to New South Wales.
Who should have been doing that, having that conversation with them, do you think?
Well, again, that'll be for others to judge, but I can certainly tell you that it's not the Victorian government. We don't make a habit of advising people of things at Kingsford Smith Airport. That's, it's in another state. So I've written to the Prime Minister this morning, not to do anything other than say, look, this shouldn't have happened, and I want everyone to work hard today to make sure we don't get more of these people arriving on Sunday, because there are more flights due then. At the end of the day, let's avoid all the inconvenience. Let's avoid, certainly for anybody who may have formed a view for whatever reason that they can travel from, say, Auckland to Melbourne. That's not on offer at the moment. It will be, and just as in the weeks and months ahead, travelling from Melbourne to Auckland may well be something that people want to do, but now's not the time for that.
Who will visit them today? Who's responsible for visiting them and explaining?
I think the Victoria Police will, and authorised officers under the Public Health and Wellbeing Act. Again, no one's asserting that they've done anything wrong. It's just a matter of making sure that they fully understand and appreciate what the rules are in Victoria, how they need to conduct themselves, and how they can play their part in making sure that we protect public health.
And at this stage, while you don't know much about these people, at this stage your understanding is they haven't. There's no suggestion they've done anything wrong. That they.
I don't believe so. No.
Is the border arrangement sold to New Zealanders that you can come to New South Wales or the Northern Territory? Is that made clear to them?
Well, obviously it wasn't made very clear to these people, these 17 people. So there's perhaps some refinements that need to be made across this entire arrangement. But you know, I don't fire off letters to the Prime Minister unless there's a need to make things formal. And our formal position, which hasn't changed, our formal position is that we are not ready to accept people into our state from other countries, even New Zealand, particularly while Victorians themselves, and particularly Melburnians, don't have the freedom of movement that they want and that they're absolutely entitled to. We're going to take some steps tomorrow. We're going to outline what the coming weeks look like. We don't want anything at all to undermine the amazing job that Victorians have done and are doing, and I'm confident will continue to do, in order to find that COVID normal. So some things have gone wrong here, but we're very much at the end of that, not necessarily part of it. In fact, we had made it very clear that we did not want to be could not be part of those bubble arrangements at this point in time.
Should Victoria consider at least temporarily shutting its border to make sure there isn't a repeat if it can't be?
Well, I know that the Prime Minister would be, I think, very disappointed if that happened. That's exactly what he's trying to avoid, and that's why I wrote to him this morning and made it clear that we need to get to the bottom of this, and then we need to have the requisite assurances that this won't happen again, and that would then avoid us having to do that. I don't want to be closing our border. It has remained open. In fact, I want us to play our part, and one case today, and now active cases down under 150, we are playing our part in getting the borders across the country open. We don't want anything to jeopardise that.
What do you need before that actually happens?
We'll go here first. Sorry, Matt.
What are the arrangements for anyone that comes from interstate to Melbourne? Like if you were coming down here for whatever reason, not from New Zealand, what are the arrangements in place for those people?
Well, they're made aware of what their obligations are. Beyond that, Brett might be able to speak to some of our quarantining arrangements and things of that nature, but our border remains open, and we're confident that the arrangements we've got in place are, robust to make sure that people.
Matter, then?
Well, it does, I think, always matter when you've got an entire agency that's in charge of our borders, who 12 hours after 17 people have turned up that were not supposed to turn up, can't tell us who they are. I think that matters. I think that's a significant issue. I'd like those cards. I'd like them quickly so we can have a proper discussion with these 17 people and just make sure that they know that in Victoria there are rules, and the rules are different to what they are in New Zealand. Again, to the issue about whether we're frustrated, the frustrating thing is that we don't know where these people are, who they are, what their reason for travelling was, or have any confidence that they know that there are rules in place in Victoria. That's why we want to see them. We're not alleging or asserting or inferring that they've done anything wrong, but there's been something has gone wrong in this system, in that we are not supposed to be part of this arrangement. And there are many things the Victorian government can do, and there are many things that we are ultimately accountable for. But who gets to board domestic flights at Kingsford Smith Airport in Sydney is not one of the things that I am accountable for, responsible for, or can have any impact on. Only others can do that.
More broadly, what would you need in terms of numbers to allow this type of travel to happen? Let's just say between New South Wales and Victoria. Take New Zealand out.
Sure. Oh, look, I think we're very close to having a situation where regional Victorians will be able to travel into New South Wales and into South Australia as well. They're for other premiers. Those arrangements are for other premiers to announce, but I think we're getting closer to that. I think once we are in a position to bring down what's sometimes called that ring of steel between Metro Melbourne and regional Victoria, then there'll be much greater freedom of movement within Victoria, obviously, and then there can be further interstate travel as well. But again, the status of borders in other states, that's very much a matter for them. But the best, most meaningful thing we can do, and I don't think it's all that far away. I think the aim has always been by Christmas that there can be that freedom of movement. That's been the Prime Minister's aim, and I've been very supportive of that and playing our part in that. And the biggest thing we can do is get these numbers low and keep them low, and that's exactly what the strategy is doing. That's exactly what Victorians are doing. We're doing more, and we're doing it perhaps faster than people thought we would, in order to get borders in WA, Queensland, New South Wales, South Australia, Tasmania open. Our biggest contribution is to get these numbers down, and as you see today, they are coming down, and it's a credit to every single Victorian.
So, Premier, with the letter that you wrote to the Prime Minister, I think you mentioned it was yesterday, did you address the potential for this to occur, for people to jump on?
No, but I didn't think there was a need to, because in the letter I made it very clear that we were not joining that New Zealand bubble. We might, in fact we'd like to at some appropriate time, but it is not appropriate to be having, with the greatest of respect to our friends in New Zealand, it's not appropriate to be having a freedom of movement from another country when people in Victoria cannot move around their own state. That just doesn't make any sense. So I didn't anticipate a problem because we had written and said we're not part of this. Turns out we were part of this, unbeknownst to us. Now I just want the cards to tell us who they are, where they are. We'll go and talk to them, and we'll make sure that they know and understand that there are rules in Victoria at this moment, and things are very delicately placed. We're very close to taking some really important steps. Again, I wish I could give you more detail about who these people were and the reasons they came here and what their status is. They could be Victorians for all we know. But it's very difficult for me to give you those answers because we simply have not been given those passenger cards yet. Hopefully they come soon.
So there was no briefing, no mention that this possibility hasn't crossed your desk at all in the past week or so?
Oh no, there was the Prime Minister wanted to know whether we would be part of it, and we indicated at some point yes, but we can't now. So that was very clear. That's just to be as complete as possible. And it wasn't like look, I think what's happened here is they've asked the question, we've provided the answer, they're perfectly happy with that. We will be in this bubble, but not now. But somehow something's gone wrong at Sydney, I think, to allow people to travel on beyond the international flight. And look, they might come back and say, oh, well, your borders are open. So, okay, that's kind of what you wanted. So I don't think that's something that we should be penalised for. Ultimately, I can't control where people go in another state. But what we can control is we've been very clear, we are not part of these arrangements. And therefore no one should be allowed to travel on beyond where flights are landing and then turn up in Melbourne. And the problem is, and I do feel for authorised officers and some of our staff at the airport, they don't run the airport. The airport is run by Australian Border Force from a security point of view, and they don't have the legal powers to be able to say, righto, I don't know that you should be here. So it gets into one of those grey areas, nor do they have the power necessarily to even determine who those people are. That's even if they knew. That's even if they knew that this had happened. And I'm not entirely sure that they did, until perhaps after the event. I haven't got a full briefing on that. I think we're most focused on finding who they are, where they are, and having a chat with them in the nicest terms, just to make sure that they know and understand that there are rules here.
But not to send them back unless they are from New Zealand?
I'm not going to speculate on what might happen to them beyond this. I don't have the power to deport people, nor do I have the power to limit people coming from other countries. That's done by the Commonwealth, and we're grateful to the Commonwealth for the partnership that we have in this. There's no one been more supportive of closing our international borders than me. It's been very, very important. But this is, I just thought it was appropriate to be upfront about it. This is an issue we have to work through, and we're focused on making sure that we don't have any more flights arriving in the same circumstances, any more passengers arriving in the same circumstances tomorrow. There are flights scheduled, I think, into Sydney tomorrow. And that's fine if they want to go to Sydney, and if Sydney's happy to be in that bubble now, terrific. We will be too at some point, just not yet. Beyond that, can I say these numbers today are a credit to every single Victorian, the hard work that they're doing. These restrictions are painful. There's hurt out there, I know that. But we said we'd get these numbers down if we all worked together and if we all stayed the course, and that's exactly what we're doing. And what this makes possible is tomorrow we'll make announcements about easing. We'll also give people a clear sense of what the following weekend and the weekend after that looks like. That is for tomorrow. I know it's frustrating. Everyone would like me to make all those announcements today, but there'll be meetings later this afternoon. In fact, I'll be going to one after I finish here with you guys. They'll go well into the evening. We'll make some very difficult calls about what is possible tomorrow, and then we'll, well away from the netball issue, we will try and make some announcements early tomorrow so as not to clash with that very important event. And it's at that point that we'll be able to talk through the detail of all of those announcements. But there will be easing tomorrow, and it is a credit to the hard work, the sacrifice, the fact that Victorians have found it within themselves to be as stubborn as this virus. It moves rapidly, it moves silently, it is deadly, and you've got to take it seriously, and that's what Victorians have done, and I'm grateful to every single Victorian who's done that. That's why we've gone from 725 cases to 1 case. That's what makes opening up possible. But this is not over. It is still not over, and we can't just throw open all the doors, get rid of all the rules, and run towards COVID normal. We have to do this in a safe and steady way. And that's exactly what we will do. Mystery cases remain a challenge for us. 17, that is a significant number. We'll see how that unfolds in the days and weeks to come. And I'll just, before I throw to Brett, if I can just again make the point, the reason why a mystery case is a real concern to us is that there's at least one other person who gave the person we know about the virus. They will have close contacts. Their close contacts will have contacts. So you can be taught, it goes to this point, do you have a complete picture? Is there virus out there that you don't know about? And mystery cases are one measure of the fact that yes, there is virus out there that we don't know about. And the other point is not everybody gets tested as soon as they should. So people do have what are called exposure days, where they'll have symptoms and they are almost certainly spreading the virus to others, and they don't go and get tested. And then there is the other point that not everyone who has symptoms ultimately gets tested, for many different reasons. Sometimes the symptoms will be so mild that they're not prompted to test. Other times they'll make a conscious decision, I'm fine, I won't go and get a test. That's why we stand here every day, and I'm sure it's monotonous, but it's so important. If you've got symptoms, no matter how mild, get tested, and get tested quickly. Today. Go today and get tested, because that's how we pull this thing up. That's how we stop the spread within your family and indeed beyond your family. And it's how we get every family across the state a better set of rules, starting with announcements tomorrow. I now might ask the Chief Health Officer just to add to my comments, and if there's any other matters we can talk about those, or by the looks of it we might have an early finish. I don't want to jinx that, but you all look like you might be interested in that. So anyway.
We live in hope. We live in hope. So the numbers of today are just one number, so one additional case. It's a remarkable achievement, really. And again, my congratulations to Victorians, but also to the pathology services who've, as we know, done thousands of tests, processed thousands of tests from Shepparton and thousands more across Victoria, and the public health team that I'm proud to lead, all the work, the thousands and thousands of hours that are put into the intelligence and epidemiology, the analysis and the modelling, the contact tracing that has been able to drive us down to this one additional case for today. It is linked to a known case in a Hoppers Crossing community outbreak, and the outbreak includes what was originally referred to as a complex case linked to Woolworths QV. So we'll go through the normal process of investigating that case, doing all of the close contact management, but also looking upstream. And this is a real key for all of our cases, in particular the mystery cases. So the upstream testing is to really find out where everyone might have got their virus from. So if it's not clear with a mystery case, we can do blood testing to see if someone's become immune. They're no longer positive on the PCR swab test, but they might have a blood test that shows that they have had the virus and recovered. and that might give us additional clues as to where they've been and where they might have gotten it from. So it goes to the point the Premier made, understanding where those chains of transmission have come from can give us some reassurance about controlling it, because we know where all the close contacts are, we can do the testing and we can isolate them if there are individuals who've been mildly symptomatic or asymptomatic and haven't isolated. If we can identify them, we can go through that process. Of course, there are mystery cases that finish in households. These restrictions that are in place help to work for all cases, including mystery cases, and the limitations on our interactions with others can sometimes just drive these mystery cases down to their end point in households as well. So the chasing up of mystery cases is absolutely critical, but all of the things that are in place for these restrictions are also an important part of driving those mystery cases down. They've typically been at about 10% of our total cases right through. We are at a point now where we've only got a tiny handful of cases each day, but those mystery cases are still averaging about one a day. So they're making up a bigger proportion of our daily total, in part because they're the hardest ones to find. They're not so easily identifiable as the ones that we discover going through that close contact tracing process. That's a much more straightforward process. The mystery cases come to us because someone's tested, but they haven't already been identified by our contact tracers as a close contact or a casual contact or someone who's been to an exposure site. With respect to mystery cases, there's a new one that has been, again, it's not in today's numbers, but it's been identified and classified for postcode 3128. That includes Box Hill, Box Hill Central, Box Hill South, Houston and Wattle Park. Happy to take questions.
So with the mystery case, we've established that it's a mystery case. You've run out of leads to try and link it somewhere else. Do we then go back and re-interview that individual? And given the experience with the truck driver the other day, and then what happens? What occurs then in that second interview?
We do. We're really trying to find out all of those clues that might allow us to link those cases to any other existing case or site, so that we can then classify it as being something other than a mystery case, contact of a known case. That's really important for us. So we'll go back as many times as we can. There are other things that we do. We'll do the genomics. We're prioritising the genomics for mystery cases. It might flag with an aged care facility, it might flag with another household cluster, so we can go back and ask those specific questions. Do you know anyone who works at this setting? Do you know anyone in your extended family, in your extended network of friends who's been to this site? So we can sometimes then follow the trail. So that's a really important process. The genomics, the re-interview, and as I say, that acquisition testing of all of the close contacts in the 2 weeks before someone's become symptomatic. So you can actually find out that maybe a parent, maybe a sibling, another household member has had a very mild illness, has recovered from it, never got tested, but it shows up in that blood test.
Professor Sutton, there's been a child diagnosed, and I'm assuming that child is the one that's in the Royal Children's Hospital at the moment. Are you able to give us any more information about that child's age and where perhaps that child may have caught the virus? Was it from a childcare centre externally, or is it linked to a family?
So look, I really can't give you more details. We need to protect the privacy of our cases. So beyond knowing that that child is in Royal Children's Hospital and is a mystery case, we haven't established the acquisition. So we'll go through that process as well. Obviously, finding out who might have been in contact in the 14 days before that child developed symptoms.
So does that mean there's a concern again about childcare, or you just can't say at this point in time?
No, there's no particular concern about childcare, but clearly we're trying to look through all of those avenues around how that infection was acquired.
I enjoyed your pun on Twitter this morning. Nice work.
You're alone.
Pardon me?
You're alone.
Yeah, no. I'm not sure if you saw a tweet from Greg Hunt about 9 o'clock. He said epidemiological conditions for COVID, safe reopening of hospitality, movement and family reunions, among others, in Victoria he's talking about, have now been firmly met. Victoria should now be able to move to the next step in line with New South Wales. Is he right?
We have epidemiologists. I'm listening to them. We've got a team of epidemiologists who are working through this. The conditions for easing in New South Wales after their first wave were actually, they'd gotten to a 14-day rolling average of under 4, I think it was. We're at 8 today. So we're not in an equivalent position. It's fantastic to have a 2 and a 1 in the last 2 days. Absolutely fantastic. But we're at 15 a few days before that. So we do need that time to see that we've got an average that is actually what all of those epidemiologists are telling us is safe. We will be making announcements tomorrow, and there will be an easing, and we'll continue to go through that process, which I've optimistically referred to as a one-way process. We want to go to an easing where there's no backward step, where we do it with the confidence that it can stay that way and that everyone can enjoy that into the long term. So we'll do that for this weekend and in the days ahead.
He's jumped the gun?
Look, Minister Hunt's not an epidemiologist. I guess he speaks to other epidemiologists who might have differing opinions. We've gone very broadly for our advice and modelling and inputs. We take the positive critiques and negative critiques equally, and people will have different opinions. But there's no question that the stakes in this are enormous, and the consequence of not being able to hold it back if you're lifting too early has already played out in Victoria. And I think there are 7,000 ICU cases in France at the moment. There are countries where 90% of ICU beds are taken up with COVID patients. We've clearly avoided that. We've got 13 hospitalised patients. We're in a very, very good position. But we don't want to be playing with risks that are unreasonable. We've taken a slow and steady approach for a reason, and it's borne out. It's borne out in regional Victoria in terms of maintaining that status where they're not getting ongoing local transmission. They've had introductions into regional Victoria, but otherwise appear to be free of the virus. That's a really fantastic achievement. And the same for Metro Melbourne. To be gradually going in this one positive direction is a remarkable achievement.
I might add to, Brett's a public servant and perhaps I'm a bit less constrained when it comes to some of these matters. If Minister Hunt is genuinely suggesting that, we're keeping this lockdown on because somehow we think Victorians are enjoying it, or it's a choice that we're making, like, this is just, it's just wrong. And I'll boldly predict that whatever I stand up here tomorrow and announce, there'll be members of that federal government, some who are from Victoria, but I don't think they're for Victoria, who will be out there saying it's not enough, you should have done more, no matter what I announce tomorrow. And what that says to me is that, we're not going to be pressured. We're not going to be engaging in what I think is a political exercise. And it does no credit to those who are involved in it. I don't know how many times I have to say it, but I'll say it again. Politics, this sort of stuff just doesn't work. It doesn't work against this virus. Other governments, other ministers, people, they're entitled to have their view. But please, no one should be suggesting that the Chief Health Officer and I and others are keeping these restrictions on any longer than they need to be, any longer than the advice says to us this is an appropriate response, so that we can open up. We are not going to risk everything that Victorians have sacrificed. And whilst people are entitled to different views, some people should reflect on the fact that they are in fact a health minister, and that actually requires a certain standard. I would have thought. We're going to see this thing off, and we're going to do it properly. And I've probably said more than I frankly intended to, and more than I'm inclined to, about people who are, I think, playing games. And this is not a game. The stakes are too high. Everything that's been done, everything that's been given, needs to count for something. And that's why this strategy is not about racing to open up, running to COVID normal. It is about safe and steady steps. And tomorrow, just tomorrow, we will make significant announcements. And we'll have more to say about what the next weekend looks like and the weekend after that.
But he's not just referring to his opinion. He's saying that epidemiological conditions for a COVID-safe reopening...
With the greatest of respect to him, it is not for him to determine whether epidemiological conditions have been met. He is not an epidemiologist. He's a politician, and I think he's making that very clear to everyone who follows his tweets, and everyone else who listens to his criticisms, and everyone else who gets briefed by him and those who work for him. I'm done with this. Like, it's an insult to the sacrifice that Victorians have made. Politics doesn't work on this, and I'm going to call it out wherever I see it from now on, because there are some people who have played politics every day of this pandemic, and Victorians are sick of it. They're also pretty sick of these rules, and that's why we're going to get some of them off tomorrow, because we've done an amazing job. Every Victorian, no matter their background, their postcode, their circumstances, people have stayed the course. We are right on the edge now of defeating this second wave. It's not occurred in many countries, if any, across the world. And you look to Europe, you look to parts of Asia, you look to North America. It's heartbreaking what's going on over there as they move into winter, particularly in the other hemisphere. That this thing likes the cold. That's what the evidence tells us. So we have avoided that, and we aim to continue to avoid that. And there'll be significant announcements tomorrow.
Premier, in terms of, there's a hairdresser in Hughesdale who's opened up today and I think swiftly being closed down by Victoria Police. Are you concerned that more businesses are going to start defying the rules?
I would certainly hope not. We're so close now, so close to being able to open up, get people back to work, get people back connected to the people they love the most, the people they've missed the most. I understand that. We're all part of families, even if you do the job that I do. We're all part of families, we're all part of communities. We're all missing the people that we love the most. I know businesses want to get back not just for their profits, but for their people, for their staff, for their customers, for their patrons. But you've got to do it safely. And look, to be honest, there was a time when we didn't even have this debate. We weren't even having a debate about whether we should open up again because the numbers were so high. This is challenging, and yes, it's painful, and there's a lot of hurt, and there'll need to be healing, and there will be, in a budget that will be unprecedented in the scale and the nature of the investments we'll make. But the fact that we can have a debate about how we open is a testament to the sacrifice and the hard work, the unique contribution that Victorians have made, and the spirit and the strength that Victorians have shown.
A similar thing happened in Berwick.
And just on the fine issue, I have seen some people, oh, well, I need to open because I've got no money. I go, well, there's assistance there. You should ring. We'll look after you if we can. Any support you need, we'll try and provide that to you. But if you're wanting to fill your till by opening up against the rules, you're going to get a $10,000 fine. So the maths of that doesn't add up. We just have to wait just a little bit longer, and then we can take some even bigger steps, and we'll announce some of that tomorrow. I feel for anybody who finds themselves in a position like that. Of course we do. And that's why there's been hundreds and hundreds and hundreds of millions of dollars worth of business support. If there's anything specifically we can do for a business like that, then we're more than happy to talk to them. Not just as a business, but as a person. If they're in that sort of financial hardship, there might be things that we can do. Might be things that they're eligible for that they don't know about. But opening up, all that'll do is get you a fine. That won't get you any takings. That won't get you any profit. That'll just get you a pretty hefty fine, and it has to be that way.
Professor, can we just take you to the emails that seem to have been unearthed regarding your apparent knowledge of private security being used in the hotel quarantine system? Can you please explain, A, whether you were aware of that, B, whether you may have misled the inquiry, and C, why those emails weren't made available to the inquiry in the first place?
So my statement to the inquiry was true. I provided it honestly. I was under oath. I take those obligations extremely seriously. I was not aware. That's what I said to the inquiry. That's what I stand by. The process of going through emails is that there's a team at DHHS that go through them. I made all of my emails, archived and otherwise, right from the start of this pandemic, available for that team to go through, and they referenced the terms of reference and the specific request of that inquiry as to what emails were being requested, and that's what they provided.
So have they made a decision to not provide that email that references private security being used in hotel quarantine to an inquiry about hotel quarantine? I
don't know that there was a decision made. I know that they've gone through a process of looking at all of the emails that fit the terms of reference of the request that was made of the inquiry, and have provided all of those, and with any additional requests they will do the same, and my emails remain absolutely available for any further requests.
But do you think this email did fit the terms of reference?
I don't know what the terms of reference are. My role is not to determine what emails go or don't go. All of my emails have been made available for the team to look through and provide according to the request.
Who's making the decision on this, not you?
Sorry?
Who's making the decision on what is given to the inquiry or not?
Well, there's been a request from the inquiry, as I understand it, with the exact details about the specific emails that fall into categories that they were requesting, and that's what was provided in the first instance. And they'll provide anything else that's requested from the inquiry.
And just in terms of this email, so do you accept that you did appear to acknowledge private security was being used in hotels?
I've responded to an email that I could see was a response to the Commonwealth with a number of questions, but I stand by the fact that I was not aware of private security being used until the outbreaks occurred.
So your acknowledgement of the email saying thanks or whatever it might have been about someone saying private security will be used, you might not have read that, or you weren't aware?
This particular email was a response to the Commonwealth where they had asked some questions. It was passed over to someone in the command structure for the hotel quarantine program. I saw that they were responding back to the Commonwealth, and I thanked them for the responses that they were given. But I clearly did not register that anything was being said about private security. Otherwise, I would have gone to the inquiry and said that I was aware of it.
Okay, so in terms of the inquiry, if they call you again to explain this further, are you happy to do that?
Of course I am. Of course I am.
They haven't called you yet, though, have they?
No, not that I'm aware of.
We heard from the Premier briefly yesterday about using technology to help in contact trace and particularly potentially using QR codes. The New South Wales government has a system already set up, a New South Wales government app that people can register when they go to businesses. Is that something that the Health Department is currently working on, a system like that to help businesses contact trace when they reopen in Melbourne, but to help those businesses that have been open for quite some time now?
Yeah, my understanding is it is being worked on. It's not for DHHS, it's for Department of Jobs, Precincts and Regions primarily, but the Premier might have more.
So there is a process via Services New South Wales, which is a different arrangement. So I think the outcome's the same, but the process is different. We will have further announcements to make quite soon about some of that QR code work, and that's more a matter of working with industry rather than working with DHHS. And we think that we'll be able to take some steps there. So there's some other technology that we're looking at as well, in terms of just assisting in that interviewing process, the establishment of where you've been, all of those sorts of things. So we'll have more to say at different points. But on the QR code type things, so the notion of instead of someone at the restaurant having to write it all down, the notion of just essentially being able to touch, if you like, and then your data is recorded. We are well on the way to getting to that point, and we'll have some more announcements to make about that. So
will that be a government system, a government app?
Well, there's a number. Some are doing this already, so there'll be some different. There's different tech, if you like, different kit. I don't think it's been finalised, but we'll get to a point where we're confident that everybody who can benefit, every setting that can benefit from that type of a platform, will have it. I don't know whether we'll necessarily prescribe one for the whole state. We may do that, but I don't think we're necessarily settled on that. There's some work going on. Some have already done this, so we wouldn't want to necessarily upset that if it's working well. But that's something that's being actively considered now. We're having discussions about that. I was having discussions about this with various officials yesterday and the day before. So we'll have more to say about that soon.
How come that isn't in place already, given that Melbourne has already been open for a period of time and then closed down again? Regional Victoria's been open for some time. New South Wales has already got the technology in place. Why hasn't it already been rolled out in Victoria?
I don't think it's a limiting factor at the moment. You've got a situation where you don't have millions of movements every day, people going back and forth to different hospitality venues. I'm confident we'll have that in place by the time we need it. But the other thing too is this is not like there's no information or there's the QR. People are writing this stuff down in country Victoria. They're doing a fantastic job. If we can assist them further and make that process even simpler, then fine. But in order for us to rely upon it, it needs to be of a certain standard. I'm confident we can get to that point. But if you look at the cafe in Kilmore, amazing, meticulous records, which is why we've thanked the owner of that cafe many, many times, because she did a fantastic job. A fantastic job in having a full list of everybody who was there, the times they were there, and that made that contact tracing work easier. And I see some, on contact tracing more broadly, I see some commentary today in the paper, a bit of this and that about why things couldn't be pulled up quicker. If someone is working and they don't tell you that they've got a job, because the job is not necessarily one that is well known to the Australian Taxation Office, just as one example, it gets really hard to then go and test all of that person's workmates and then their close contacts and their contacts. So, you know, this is a human exercise. This is a human exercise, and there'll be all the variability and all the vagaries of everybody's personal circumstances, and they have to be navigated, and that's not always easy. Then, of course, there's people who decide to go and visit regional communities and not tell us that they've done that. But the virus has a way of, you know, you finish up finding out, because people go and get tested, they're positive, you interview them, they give you a more complete picture, and away we go from there. The whole thing can be avoided, though, if people follow the rules. And in the event that you get the virus, and there's no sense of shame or stigma that you've become infected, this thing doesn't discriminate, and we certainly don't. But you've just got to give us the most complete picture. Because when you're talking to a contact tracer, when you're talking to, it's like talking to your GP, it's like talking to, you know, anyone in a trusted setting. All we want is the corona information. We don't want to know, and we don't much care about the other stuff, and we'll respect your privacy. But you've just got to be open with us so that we can protect your family and every single family.
Premier, can I just ask about the seeming inadmission of these documents by DHHS? Is this a concern to you that emails specifically referencing hotel quarantine were not provided to the hotel quarantine inquiry?
Well, look, I wouldn't necessarily be drawn on what my views on that are. I think this is a matter of fact.
It's a pretty huge failing, though, isn't it? I mean, this is pretty central to the entire inquiry.
Yeah, well, we're not necessarily in anything other than furious agreement, Matt. What I'm saying to you is I'm not going to speculate on those matters. I don't think that I can usefully speculate on those matters. That judgment and other judgments are exactly the things that the Board of Inquiry will look to, and it's not for me to in any way influence or characterise findings that they may make. They're free to form a view on that issue and lots of other issues, and I'm very confident that they will.
And do you stand by Professor Sutton, who is obviously standing by you physically right now, but do you...
Well, he's not only standing beside me physically, he's standing beside every family across Victoria. And the work that he and Alan Cheng and all the other team have done is a credit to them and the teams they lead, and they have my complete confidence. And one of the reasons, I know I mentioned before, that tomorrow we'll be able to make some announcements, and that's all down to the good people of this great state who have stayed the course on this. But it's also in part due to the quality of the advice we get and the fact that actual epidemiologists, not politicians, are not engaging in anything other than a public health, so save lives, and then we can move to save livelihoods. That's what we're going to do, and tomorrow's a really important part of that. And the Chief Health Officer and his deputies have my confidence, and they should enjoy the confidence of all Victorians, because they're working very hard for all Victorians.
Is there a potential that the sifting out of these documents might have happened at other departments, like DPC, your department? Could they have made a judgment that some documents were not within the terms of reference when they clearly were?
I can't speak to that. Only the inquiry can speak to that.
Does it surprise you that there's an extraordinary sitting being slated in for Tuesday?
I don't know any more about that than you do.
Does it surprise you?
I'm fairly focused on other matters, to be honest. I don't know that I've necessarily turned my mind to it. It doesn't involve me. I don't know what they're going to be doing. That's entirely a matter for them, and they'd have to speak to you to the extent that they chose to about what it is they plan to do on Tuesday.
What was your reaction to it last night?
It's an independent process, and it should be independent, and it's not a matter of engaging with me. I've set it up. Where it goes, it goes. That's the nature of an arm's length independent process, and I think they're going to provide a report in just a few weeks' time, and we'll all be able to speak much more freely. And again, I'll just remind Victorians I will not hesitate to take the action that is required to make sure that these sorts of errors never occur again, but I'm going to be best placed to do that once I've seen the report and whatever findings, whatever recommendations are made, which is only a few weeks away.
You haven't been called?
No.
No. Do you think it might blow out the deadline for the report?
Well, again, I'll be clear. I don't know that that's the case. I've not had any requests. I'm pretty sure that if that was the case, then Judge Cope would write to me and would seek more time. That's not happened.
You'd obviously hope that's not the case.
I would certainly prefer the report to be ready on the day that was nominated. I think the 6th of November.
Or by then, yeah.
Yeah, by then. So I can't offer much more than that. I
don't
hope
know
they meet their deadline. I don't know. I have no knowledge that they're not going to, but that is ultimately a matter for them, and that is the nature of independent processes. They will make their own judgments, and that's why you set them up. They're away from government. They're not part of government, and they will, without fear or favour, work through all these issues.
You're aware of anyone who has been called?
No.
No.
But I wouldn't be, because that wouldn't be.
Politicians talk?
Well, that wouldn't be appropriate. That's a matter for my knowledge of those matters wouldn't be appropriate. You'd have to speak to them.
Is the budget waiting on the inquiry to hand down its findings? Is that why we haven't had a budget yet, or
No, the budget's waiting. The budget's waiting until all the enormous amounts of work that are being done to put it together are finished, and there'll be a budget next year as well. So I'm not indicating that it's not a continuous process. It is, but I think this is unique in terms of the size of the challenge, the amount of hurt, the amount of pain, the amount of healing and investment that will need to be done across our state, not just in an economic sense. We have, in the 5 years before this virus, we'd created across Victoria 500,000 new jobs. But you don't create those jobs just in and of themselves. You create them for really powerful reasons, so that families can feed their kids, so that families can have a sense of confidence about the people they love the most, have a sense of security as they look to the weeks and the months and the years ahead. So we will deal with a lot of the pain, a lot of the damage that this pandemic has done, and it'll be in building, large projects and small. It'll be in supporting mental health, supporting the most vulnerable, supporting those that have become vulnerable. Women have had to carry a disproportionate amount of the burden, the load of this thing. So that'll be a feature. Again, I won't go much further, otherwise Tim Palace will be upset with me, but it's going to be unprecedented matter. It will be in size and scale because the challenge is like we've never seen before. This is perhaps the toughest year that our state has ever faced. Certainly in the living memory of the vast majority of Victorians.
Is there likely to be tax reform or anything that's designed to stimulate, I don't know, say stamp duty reforms or anything like that will actually be structural reforms, or is it just going to be one-off sort of?
The budget will be delivered on budget day, and there will be many different policy responses, significant investment in lots of different ways to make sure that we can come out of this and not just repair the damage, but be stronger than we have ever been. And, it will be unprecedented. No one will ever have seen a state budget like this before, because it needs to be. It absolutely needs to be, because of the pain and the hurt, the damage that this virus has done to us. But I think just as we've been equal to the task of getting numbers down, we are equal to the task of keeping them down, and we're absolutely equal to the challenge and the task of rebuilding. We are absolutely equal to that, but it'll mean support. Whether it's tutors to make sure that any child that's slipped behind gets back on track, whether it's more support for TAFE so that everyone can get the skills they need for the job they want and the job that we as a community need them to do. Where there's an opportunity here to deal with some other issues as well. The toxicity of insecure work, the fact that family violence is still a massive challenge across our state, the fact that we've got a broken mental health system. All of these things were known to us, I think, before the pandemic, but they've come into sharp focus. And this budget, this year, is a call to act, and we will do that. We absolutely will.
If I could ask from healthcare workers, has there been any further consideration of N95 face masks, and should they be rolled out to all healthcare workers rather than just some of them?
Let me get a specific answer on where there's some trialling going on, there's a process going on, there are meetings multiple times each week that the Chief Medical Officer, Professor Andrew Wilson, convenes. That's with unions and others. Everybody from the AMA all the way through to people that proudly represent cooks and cleaners and clerks. Let's try and get you a detailed answer on where that's up to. I'm not briefed on that recently. It's an ongoing process, but if there's anything we can add, we can certainly get that for you.
Premier, with the arrivals, was there any discussion that, sorry, this is probably a question for Professor Sutton, if you don't mind.
Yeah, AHPPC.
AHPCC
Yeah, sure.
of these issues this week that you were aware of?
Certainly we've had discussions about the travel bubble and what risk assessment would be done of the situation in New Zealand, but ultimately it was a matter for First Ministers to opt into the scheme. HPPC, has provided advice that it was not unreasonable to open up the possibility of a travel bubble with those, very low risk, negligible risk countries that New Zealand fortunately sits in.
Did they say there was a risk of onward travel from other cities, or
no? That's not really an issue. Up to the point of time that the travel bubble's been in place, everyone, Australian citizens, permanent residents have been quarantining in their first port of call. The issue about a travel bubble where those quarantine arrangements aren't required is because the risk is so negligible from those countries of origin, New Zealand in this case.
So was it raised at AHPCC at all that Victoria didn't have powers of detention if anybody was to show up?
It essentially applies in every state and territory in large part because, again, the agreement that we have for mandatory quarantine arrangements are for it to occur in the first port of entry for international travellers, and then their onward travel is really a matter of whether or not there are border restrictions in place, which is obviously the case in much of Australia, but not for Victoria.
Right, so let me just put that context in question. So we've been told this morning that Kerry Chan raised the matter in a meeting on Monday with AHPCC, pointing out specifically that Victoria didn't have powers of detention for people who showed up in Victoria having arrived in Australia under the travel bubble, and the Victorian representatives they were there on that particular day didn't seem particularly concerned. Is that your understanding?
Well, the committee's committee in confidence for its deliberations, but I wasn't there on the Monday. As far as I'm
happy to, if I could. No one's looking to necessarily, get into a blame game about how this happened. I just want the cards from Border Force so we can chase this up, right? So that's the first point. And ultimately, AHPPC is an advice-creating and advice-giving body. It has no executive authority. This matter would have come to National Cabinet. That meeting didn't happen. The Prime Minister got stuck up in Queensland. Our position's been very clear. Very clear. I wrote to him earlier in the week and simply said, great idea, not now. We'll do it later, when it's safe to do so. Now, these people have turned up. Don't know quite how that happened, but it did. Let's make sure it doesn't happen again. That's exactly what we're doing. There are some flights scheduled for Sunday. I think that we've got every chance of making sure that if people want to come to Sydney, then they can stay in Sydney. They're not coming to us. And yes, you're right, there are some issues about whether we have the powers to respond to that. But I suppose it's probably superseded by the fact that we've said we are not part of this bubble. So on that basis, I don't think it's unfair to assume that people won't be travelling beyond the international airport where they land, noting that that is not Melbourne Airport, and it will not be Melbourne Airport until we make an active decision to resume international flights, whether they be from New Zealand or from anywhere else.
Sure, but that's an assumption, isn't it? It's an assumption that the New South Wales Authority or Border Force are going to stop people getting on planes, onward flights, transit flights, once they arrive in New South Wales in this case.
I suppose it is, and I don't know that there's much else that we can do. Like, we're the government of Victoria. We can't control what happens. Like, we don't issue passports, we don't issue visas. I'm not in charge of the international border, and I'm certainly not in charge of what happens at Sydney Airport. It's not so much about blaming people. It's happened. We can't change it. It's happened. But let's make sure it doesn't happen again, and let's make sure we reach out to these people by getting the information, pretty simple information, and a pretty simple request. Let's hope in the hour or so we've been having this lovely, polite discussion about very important matters. Hopefully those cards have turned up, and we can get out there and talk to them, and just make sure that they know that they've got to wear a mask and they can't be wandering around doing everything as if they're back in New Zealand, because they're not.
So would you say then that you formalised your request or clarified your request of the Commonwealth not to let people on planes from Sydney to Melbourne or other points of arrival in the travel bubble?
Today, in my letter to the Prime Minister, I don't think there's any doubt we made it very clear we are not part of this bubble. We may be, but we are not part of it now.
But is that the same as
Then
saying,
we've become
is that the same as
inadvert-
saying, sorry to interrupt you, but is that the same as saying don't let people on planes?
Well, I read it to be the same thing. We're not part of the bubble. Next thing, 17 people have turned up. That means something's gone wrong. Didn't go wrong in Victoria. It went wrong somewhere else. Again, we can't change that. Let's just make sure we reach out to these people and that we don't have any more people arrive in the same or similar circumstances. There's a very clear letter from me to the Prime Minister. We're not part of this. I've then written again today, because he may not even be aware of this, but he will be now, because I wrote to him this morning and said, look, let's just all be clear. There's an issue here. We have to deal with it. And I made it clear I don't want to close it. I don't want to close the Victorian border, but if I have to do it, I will, because I'm just not having people turn up here from another country. And the first we find out about it is, well, you know, when they're already here, and we've got no powers because they've come from a place that is very low risk. But this is a game about very low risks at the moment. This whole thing is about very low risks and trying to keep them low and not having them explode. The other thing too is I just don't think it's fair. The notion that you can be travelling freely from another country into Victoria while Victorians can't freely move around their own state for the best of public health reasons. So I don't see it as any more or less than that. Let's all just work and make sure that we get the details and we make sure that it doesn't happen tomorrow or Monday or any other day, until it's safe for us to be part of that bubble. And that'll be an absolutely fantastic day at some point in the future. Any other issues?
Can you
If
tell
not,
us anything about what we're going to hear tomorrow?
I'll say I'll make announcements about these matters tomorrow, and that'll occur not today. It'll occur tomorrow.
Because when we keep seeing that, the numbers are so low, the expectations get high, and then
I'm aware of that. What I would say is this: yes, the numbers are low, and that's a credit to the work that every single Victorian has done, is doing, and I'm confident will continue to do. It should be a point of pride. Victorians have shown what they're made of. Yes, we've stayed apart, because that's what we've got to do to stop the spread of this virus, but we have stuck together, and that's the most important thing. We've got to see this through. There will be announcements tomorrow. The numbers are low. Be proud of that, be confident, be optimistic about that. But also understand there are 17 mystery cases out there and they all got it from someone. Not everyone tests as fast as they should, and not everyone tests as they should. Some people never get a test. There's more of this out there than we think, and we have to be very conservative and careful. We can't sprint to COVID normal. We have got to take safe and steady steps. I've said it all along, because as unpopular as it might be, it's what's right. And that's what we have to do, not the popular thing. We have to do the right thing. That's what leadership is about. It's what I offer. It's what I'm doing. And with the community, we're going to get this done. And tomorrow will be not every step we had hoped to take tomorrow, but we'll have more to say about what the next weekend and the weekend after that looks like. And people will have the ability to plan, but those announcements really are for tomorrow.
Can I just ask on that though? So you're going to plan out, but we saw that happen last time and then it sort of went back and then forward again. Is that still a chance to happen? Is there going to be a plan that is then changeable by every other week? No,
I think that we can have some confidence that what we outline tomorrow will be able to deliver. That's always got to be caveated though. This is not a static thing. It's not a stationary target. It's a moving enemy, and it moves quickly and silently. Things can go wrong, particularly when you think about some of the examples I used before about you don't always get a complete picture. It's a big contact tracing team, and I just don't think it's fair on them or on the process and the many hundreds of thousands of hours that they've worked to be they sort of throw away criticisms, these lines that people like to trade in. They're all working their guts out, but they can only go on what they're given. And if they're not given the truth or a complete picture, that does get hard. It does get hard. But I'm very confident that we'll map out, lay out some further small steps, gradual, and we'll get to that point that we'll get to COVID normal, and we'll see a very different Melbourne and a very different regional Victoria over the next couple of weeks. And I'm confident that we will be able to meet those targets.
Because we're all focusing on obviously the loosening of restrictions, but will you be mapping out what would happen if things went in the other direction? If there were sudden outbreaks with large numbers,
no,
what you would do?
Today's not the day for that. We'll have more to say about those issues, and that's a perfectly legitimate question. Well, okay, what if 3 months goes by and we have X number of cases on a day and all that? That's not for today. That might not even be for tomorrow, but we will, over the course of the next few weeks, speak a bit more about that. But I would just take you back to this notion of cases, primary contacts, secondary contacts, where you might finish up with it through an absolutely precautionary principle, many hundreds of people locked down, where only a small number of people have got it, but you lock down everyone that they've been with. With those few hundred people, they essentially allow hundreds of thousands of others to be open and to go about their business. And you can only bring that approach to this task when the numbers are very low. Otherwise, we'd literally be isolating. And that isolation is proper ISO, like you're not getting out, you're in your home and you're not leaving. We would have finished up with hundreds of thousands of people in that sort of circumstance earlier. And of course, you've got to check on them, you've got to provide for them. It's very, very difficult. You can do this now, though. Move to those kind of wedges where you have hundreds that are at home, and then hundreds of thousands of others can go about their business. That's possible when the numbers are low. In any event, we'll have more to say tomorrow, and it'll be a credit to every Victorian who's built these numbers. They've absolutely driven these numbers down, and I'm proud of every single Victorian who's played a part in that. And tomorrow will be a good day. Today's a good day. Today's a day about optimism and positivity. But it's not about popularity in politics. It's about just getting the job done. And the final message, if you've got symptoms, please go and get tested today. Don't wait till Monday. Go and get tested today to protect your family and every family. And if there's no other issues, we'll see you tomorrow.
Sorry, Premier, just one more. Sorry. Have
Literally couldn't have gone any quicker, and still you got me.
Have
Yes,
you looked
Noel?
into the legal position, and it may be a question for Border Force, but if we, Victoria, looked into the legal position of them limiting onward travel within Australia's borders once somebody has legally entered the country?
No, but I expect that they'll be looking at that matter, because now we've got a situation. So just very quickly, what's happened here is I think that the model has been set up and it assumes that everybody is participating. Now, it's complicated by the fact that I'm pretty sure they don't assume that Queensland's participating because their border's shut. They don't assume WA's participating because their border's shut, Tasmania, South Australia, so on and so forth. I think this is one of those anomalies, if you like, where it's happened because it can happen because our border is open. And maybe there's not been sufficient thought at that national level to that fact. In any event, I'm confident people will be looking at that very closely today. Let's get the cards, let's make contact with these people, and let's make sure that no more arrive in the same or similar circumstances tomorrow or any other day, unless and until we get to that agreement where a letter with my signature to the Prime Minister says, yep, this bubble's a great idea and we want to be part of it. That day will come, but it's not today. And it certainly wasn't 5:30 last night. Thank you. See you tomorrow.
Thank you.
Thank you.